Hey, coming to you today to talk a little bit about bag mask ventilation. So, one of the techniques as a nurse anesthesia provider that we really need to master is bag mask ventilation. Now, why is that so important? Well, as anesthesia providers, we are airway experts. So, we have to be comfortable and knowledgeable on how to actually not just place endotracheal tubes, but also manage ventilation through bag mask ventilation because sometimes if we cannot get a tube placed, we can bag mask ventilate them long enough to get accessory devices in here to help us or to maintain the airway for even sometimes extended periods of time. So, how do we do bag mask ventilation? Well, first of all, once we have our patient asleep and we're going to move air on them through something like an ambu bag, here's what we're going to do. So, we have to really know how to place our hands. So, the first thing we're going to do is we're going to place the mask over the patient's face. And so, we have obviously this curvature part here is going to be placed over the nose, and then we've got the rest being placed on the chin. Then we're going to form this C and E with our hands that you've heard about before, I'm sure. So I have a C with these two fingers here that I'm putting over the mask here and pressing it down a little bit into the face. But it's only slight pressure on the face because I'm going to talk about a technique that really is going to enhance moving air or ventilating your patients with a mask. The second thing we're going to do is take these other three fingers and we're going to put them on the bony prominences of the mandible here, coming all the way back down to the angle of the mandible with your pinky if you can. Now, if we are just pressing this mask down into the face, then we're really not going to be able to move air very well because what we potentially are doing is pushing the chin down and then pushing the trachea closed or really kind of occluding the trachea by the tissue that is relaxed and by pushing that chin down. So we may not be able to move air. So the first technique that we have really is to take the patient and put them in what's called the sniffing position. By putting them in the sniffing position, you're actually taking the nose, pushing it back towards their head by putting your hand underneath the occiput of the head and pushing it forward to put them in what's called the sniffing position. I also have, again, my three fingers still on the bony prominences of the mandible. I've got my two fingers here with a C. I'm applying slight pressure. And then what I'm doing is I am pulling this chin back into the mask. So I'm not pressing down hard on the mask to push into the face, but I'm more pulling the chin, pulling this airway up into the mask to help provide here. Now, if I'm unable to still provide breath, I need to figure out, do I have a leak around this area here where the mask is in any of the areas, which means I would need to then adjust my hand in different ways to actually create a great seal to then move air. If not, if that still was not working, then we can actually move towards placing an oral or a nasopharyngeal airway. Now, as an anesthesia provider, primarily what we're placing is an oral pharyngeal airway versus a nasopharyngeal airway. So here we would get a properly sized oropharyngeal airway. We would then take potentially a tongue depressor, put obviously the tongue depressor here to get the tongue out of the way, slide the oral airway in, then again, put your mask on, create your seal, put them in a sniffing position, lift up into the mask, squeeze your back, and here we would be able to see that we're moving air overall. Now, say that we did not have an oropharyngeal airway in. Then we could potentially use a nasopharyngeal airway if we had one of those. So if we're looking at the nasopharyngeal airway, you can obviously see here that if you look closely, and hopefully I can show this to you, you have a bevel. When you use one of these, you want to lube it up with some petroleum jelly. Then you want to put the bevel side, you want to put the open bevel side towards the septum, and then you're going to slide this in to the nasal cavity till it hubs, and then again apply your mask, lift up into the mask. Same CE is what we have here. We've got the fingers here on the mandible, lifting it up into the mask while I'm gently pressing the mask down onto the face. Squeeze, and then we see if we can move air. Again, if we have a leak, we need to check where our fingers are and see if there's a seal that's not good here. Now, with some of our patients who obviously may be morbidly obese, have a little bit of a different airway structure, they may have large beards or things that create problems with bag mask ventilation. Again, I would a lot of times put an oral airway in them, but then I'll ask for a second provider or a second set of hands to help assist with the bag mask ventilation. So at this point, again, I've been unable to move air. I've tried all my other techniques. Then what I'm going to do is a two-handed jaw thrust. So now I'm going to put my thumbs over the mask. So as I put my thumbs over the mask, I'm now pressing them down just like the C was doing. And then I'm grabbing underneath the angle of the mandible on both sides and I'm lifting up. So now I am getting a good jaw thrust on both sides. Again, pressing that mask up against the face to create a good seal. And then the second provider, in this case, would be squeezing the bag to help move the air or to ventilate the patient. So these are all techniques to kind of think about as you start troubleshooting bag mask ventilation. And especially if you have difficulty with it, what are kind of the proper steps and techniques to go from a one-person technique to using a one-person technique with an assist device to then also transitioning to a two-person technique here at the end. So thanks for following me, and I hope this information helped as you talk about bag mask ventilation.